Alright, so today we're going to talk about the shoulder. You all are exercise science majors hoping to go into a field related to exercise science. That could be strength and conditioning, athletic training, physical therapy, nursing for some people. It's a good caveat into a lot of health sciences. So the aim for this presentation is for mainly freshmen and sophomores going into exercise science. We do have some juniors or seniors sprinkled in, and that's okay. But the main target is going to be freshmen and sophomores who don't have this information yet. At the end of the presentation, I'm going to hand out this evaluation for you guys to fill out. It's all going to be anonymous, so just set it by the door before you leave. Questions for you guys to answer about my performance for our slides and for our presentation and how you felt that it went. Alright, so we're going to go ahead and get started. Today we're going to talk about the shoulder. We're going to go through bony anatomy and how to learn palpation skills, how to use your hands to learn about other people's bodies and how to use that learning and how to use that feeling to incorporate the learning that you're having in class. So we're going to start with the shoulder in general. The shoulder is a ball and socket joint that is multi-directional. So that means that it goes in a lot of different motions, and that's what we're going to learn today. We're going to learn the 6 ways that the shoulder goes. It has the most degrees of motion of any joint in the body, and so that's why it's really important for us to learn all of them and how to measure them, because they can be different for every person. It's also the most unstable joint in the body. That means that it can dislocate very easily depending on the sport that people play or just the way that their body is and what they're predisposed to. So first off, we're going to start off with the bones of the shoulder and the arm. We also have some models over here. We have a skeleton that we can go off of. If you're not comfortable palpating, please just let me know and we can use this also. So we'll go through it on here, and then what we're going to do is we're going to get in groups, smaller groups. We can use the tables and we can palpate on each other and try to incorporate the learning that we're doing on the slides and put it into real life. So the shoulder complex is made up of 3 bones that we're going to focus on. First is the clavicle or the collarbone. So this is the one that goes across the front here. It articulates laterally with the acromion out here and then medially with the sternum here in the middle. The next one that we're going to focus on is the scapula, and this is going to be the main bone that we're going to focus on, and when we're learning palpation, this is our starting point for most things. And then our biggest one is going to be the humerus, so this is the big bone in the arm. It articulates with the acromion and then down at the elbow. So here we have front and back views of all of them. What we're going to focus on for the scapula is the spine of the scapula. So this region here that comes across, it forms on the acromion and then comes all the way to the medial border. And we're going to learn how to palpate these and what that's going to feel like for you guys when you're feeling it on each other. The clavicle is an S-shaped bone, and so it's a little bit irregular from our normal straight bones here, and then the humerus is more of a regular bone. So this is our first landmark trail. So what we're going to do for our learning tasks, we're going to look through what we are wanting to palpate. So these things are what's going to help you incorporate the learning into real life. So we're going to go through the trails, and we're going to, I'll walk you through how to find each landmark. And then I'm going to give you time to practice on your own and feel it on your own and come up with some words that you might think that can describe the things that you're feeling. So this first one, excuse me, we're going to go along the edges of the scapula here, and we're going to go through the spine of the scapula. We're going to learn how to find the medial border, and then we're going to learn and palpate the inferior angle down here, the superior angle up here right next to the clavicle, and then we're going to go into the lateral border out here. And then the second one we're not going to do today. We'll just focus on this first one. And there will be a list for you guys at the end of which ones we'll focus on. All right, so spine of the scapula. So for you guys to palpate these on each other, First off, we're going to use 2 fingers to palpate. It's the easiest way to feel what we're doing. Some people will use all 4. Depends on a preference and how you feel like as a clinician that works best for you. All right, so the first thing that you're going to do is your partner's going to be prone, which means laying on their stomach. So you have full access to their back and their shoulder, and you can palpate the structures that you need to. You're going to lay your hand across the upper back, and you're going to slide your fingertips inferior until they roll over the superficial spine of the scapula. So right here is what we're looking for. So if you start up on their trap or on top of their shoulder, you'll just walk your fingers down until you feel that spine of the scapula. You can use your fingers and just go vertically up and down, so then you can find where the borders of the spine are. And then you can go medial and lateral to find where the edges of that spine are. Once you walk your fingers over to the very middle of the scapula, or towards the middle, to the midline of the scapula, you'll find the mid border here, and that's the second thing that we're going to palpate. So again, to find this one a little bit easier, you can take your partner's arm and bend it at the elbow and put it on their lower back, and their scapula is going to pop up a little bit, so it gives it a little bit of an easier access point for you guys. Once you put their hand there, they'll look like this when they're laying down. Their scapula will raise up a little bit, and then this medial side that you're going to feel, this is the medial border of the scapula, and that's what you're looking to palpate. So you can follow this one all the way up, and then all the way down, and that will take you to the next 2 things that we're going to palpate. So the inferior angle, inferior means down, so that's going to be at the very bottom of the scapula. So once we've walked over the spine down to the midline, down to the medial border, we'll walk our fingers all the way down to where we feel the scapula kind of curving at the bottom. And it will kind of turn a corner, and this corner is what we're going to call the inferior angle. So that will tell you you're down at the bottom, the very tip of the scapula. All of these, your patient's going to be laying on their back, so you have full access to this. The second one, to find the superior angle, this one's a little bit more difficult. The spine of the scapula sticks out a little bit more, and as you can see, this one kind of depresses in a little bit, and it's buried under a lot of soft tissue. So this one you're going to have to fight a little bit and push a little harder to feel. That's why finding the medial border is so important. So you can walk your fingers up the medial border, and then once you get about here, you'll have to push a little bit harder to find and palpate into the tissue and find the superior angle. Superior means above, so it's the very top angle of the scapula. Are there any questions on this one? All right. So the next landmark trail, actually, let's take a break, and we're going to do part of our first learning task. So now that you've learned these trails, you need to connect it to what it's like in real life to do these skills and what it's like to feel them. So what I want you to do is get in groups of 2 or 3. Since we don't have too many people, 2 is okay. And I want you to describe to each other what you're feeling while you're doing these palpations. I want you to think about the bony landmarks that you're feeling, why they are important for you to learn. And then in your groups, I want you to come up with 3 ways that palpation skills might be important to you as an exercise science major. So think about those. I'll be walking around if you have questions, or we can do it up here if you need help. So get into groups of 2 or 3. You can flip up the tables for a pad if you need to. And then I'll walk around if you have questions. you off a little bit. It doesn't have the sensory feeling that your fingers do. So if you use your fingers, you'll get a little better of a feel. If you need me to go back on any slides, let me know. There you go. Is that a little uncomfortable? Oh, there you go. There you go. How much higher does all right, so you're thinking here. So then we're right on the edge of the spine of the scapula. So then you're going to feel how it kind of depresses a little bit. You have to push in, and then it's going to be like right in here. It's going to be superior ankle. So spine is going to be like right there, and then half an inch right here. I said we heard before she goes like this. And like it doesn't go back down. Do this side. Like that. Just relax. So yeah, you can already see it stick up. It doesn't hurt them, even if you like kind of get in there a little bit. So this one is super easy to find. So even if you pull on it, sometimes it'll be a little bit of a stretch. You can get So what we're doing is we're starting up top. If you go too far forward, you have clavicle, and then you hit soft tissue, which should be the traps, and then the next bony thing you hit should be the spine. So then if you walk out this way, that's what we'll do next. But if you walk out here, you find the medial border, and then if you come up, this one you have to press minus. You guys finding everything okay? Make sure each group does it on each other so everybody gets a chance to feel, and be thinking about how you can use these towards exercise science or whatever kind of job you might have later. Your stick of what? Oh, yeah, this one's like more. Oh my gosh, my trash is so slow. Where's that? So then, here's spine for sure, because spine's working bony. And you have to push in a little bit more. Is right there. You do have to push a little bit harder. To the left, we're going to go near. There it is. On the other side? Yeah. So I love it. Kind of like move my legs together up. Would that be the top? Let's see here again. So relax. So your superior, this is the edge of your spine of the scapula, so that your superior angle would be somewhere in there. If you're laying down. No, that's not. Yeah, so it's right in there. It's pretty close. Does everybody feel pretty comfortable with those? All right, let's come back together. We're going to use the spine of the scapula to go onto our next piece. This one, we're going to look at these ones next. We're going to walk through the acromion, the clavicle, the AC joint and the SC joint, and then the coracoid process and the deltoid tuberosity. So now we're going to come a little bit more to the side of the shoulder, off the scapula and onto the parts where the arm articulates with the shoulder girdle. So we're going to walk our fingers up the spine of the scapula, and we're going to find the acromion here on the very end. So this part, your patient can be either seated in their chair or supine, which is laying on their back. And what we're going to do is locate spine of the scapula, And then follow the spine laterally, so this is on the outside, to the very tip of the shoulder, and it's the bone that we're going to feel on the very end. Some people, it's really bony, and you can even see it sometimes without even touching them. And then some people, we will have to palpate a little bit harder because there'll be a lot of trap muscles that cover that. So palpate the acromion, and then right there is also where it attaches to the clavicle. So we have a lot going on right here, and we'll need to differentiate if we can feel the different bones and the joint that happens right there. So then once we find acromion, we can walk our way in the front, and we're going to go more medial again, and we're going to find the clavicle. So in this one, on some people, again, you can see it, and on some people you can't. This one we palpate with our fingers, and we don't want to be too hard because it can be kind of uncomfortable. So they can be seated or supine again. You find the acromion, walk your fingers medial down the shaft of the clavicle. On some people you can feel the S shape that it has. You can feel how it kind of elevates and then depresses. And so that's something I want you to look at when you're palpating, is try and observe on which people you can feel that and why that might be. And then in here it curves inferiorly down there, and then it articulates with the sternum. So that's another bone that we're going to be able to feel again. So we're here where the acromion articulates with the clavicle. We have the acromioclavicular joint. This joint has very, very little movement. It's still considered a synovial joint, but it doesn't move on its own really, and it's not supposed to move. There's a lot of ligaments that hold it in place. So when we're palpating, you might be able to feel a little bit of a depression in here where the joint happens, depending on how much soft tissue is around there on your patient. So again, they're seated or supine. You locate the acromion and go just a little medially. If you hit the clavicle, you went too far, so backtrack and see if you can find that depression in there.